Good morning. The time is 8:31 a.m. and the Oregon Board of Physical Therapy is entering into public session. Michelle, please call the roll.
Yes, ma'am. Timothy,
Here.
Aaron,
Here.
Mariah,
Here.
Sandra,
Here.
Oku,
Here.
Susan.
Here.
For the record, Erica is excused. Dwight.
Here.
For staff, Michelle present. Sherry,
Here.
Gayla,
Here.
Sarah,
Here.
Joanna.
Here.
Madam Chair, for the record, there are members of the public present.
Okay. Next item is the board will now entertain motions as a result of executive session.
This is Sandra. In case number PT 939-01/26, I move to close the case and issue a confidential advisory letter.
I second the motion.
First and seconded. Roll call vote. Timothy,
Aye.
Aaron,
I would like to recuse myself from this case.
Mariah,
Aye.
Sandra,
Aye.
Oku,
Aye.
Susan.
Aye.
Erica is excused, and Dwight.
Aye.
Madam Chair, the motion carries unanimously
Okay.
with one recusal and one excused absence.
Okay. Next case.
In case number PT 957-04/26, I move to close the case.
I second the motion.
Motion is first seconded. Roll call vote. Timothy,
Aye.
Aaron,
Aye.
Mariah,
Aye.
Sandra,
Aye.
Oku,
Aye.
Susan.
Aye.
Erica is excused. Dwight.
Aye.
Madam Chair, motion carries unanimously.
Okay. Next case.
In case number PT 962-05/26, I move to close case and issue a confidential advisory letter.
I second the motion.
First and seconded. Roll call vote. Timothy,
Aye.
Aaron,
Aye.
Mariah,
Aye.
Sandra,
Aye.
Oku,
Aye.
Susan.
Aye.
Erica is excused. Dwight.
Aye.
Madam Chair, the motion carries unanimously.
Okay. Next case, please.
In cases number PT 963 A, B, C, D, E, F -05/26, I move to close cases.
I second the motion.
Motion is first and seconded. Roll call vote. Timothy,
Aye.
Aaron,
Aye.
Mariah,
Aye.
Sandra,
Aye.
Oku,
Aye.
Susan.
Aye.
Erica is excused. Dwight.
Aye.
Madam Chair, motion carries unanimously.
Thank you. Next case.
In case number PT 952-04/26, I move to close case.
I second the motion.
First and seconded. Roll call vote. Timothy,
Aye.
Aaron,
Aye.
Mariah,
Aye.
Sandra,
Aye.
Oku,
Aye.
Susan.
Aye.
Erica is excused. Dwight.
Aye.
Madam Chair, motion carries unanimously.
Okay. Thank you. Next case, please.
In case number PT 953-04/26, I move to offer a settlement agreement with a $250 civil penalty for violation of ORS 688.020 parentheses 1 parentheses little a.
I second the motion.
First and seconded, roll call vote. Timothy,
Aye.
Aaron,
Aye.
Mariah,
Aye.
Sandra,
Nay.
Hoku,
Aye.
Susan.
Aye.
Erica is excused. Dwight,
Aye.
Madam Chair, the motion carries.
Okay, thank you. Next case.
I move to ratify the administration closure of case PT 951-03/26.
I second the motion.
Motion is first and seconded. Roll call vote. Timothy,
I'm going to recuse myself of this vote, please.
absolutely. Aaron,
Aye.
Mariah,
Aye.
Sandra,
Aye.
Hoku,
Aye.
Susan.
Aye.
Erica is excused. Dwight,
Aye.
Madam Chair, the motion carries unanimously minus the recusal on that one.
Okay, thank you. Next case, please.
We're ready for the consent agenda?
I guess we will
Uh,
move on to the next item, which would be the consent agenda.
And Madam Chair, would you like to appoint someone to read out the mission into the record?
Aaron, would you please read the purpose?
Yes, the statutory purpose is to protect the public health, safety, and welfare for all Oregonians by maintaining standards for quality care, professional skill, and competence through the effective regulation of the practice of physical therapy.
Thank you.
Consent agenda today. One of the additional materials is the copy of the governor's or the report that is submitted to the governor's office and to the legislative fiscal office or LFO. This is something that's required by statute as part of the semi-independent status for the agency that covers the prior biennium once it's been fully audited and vetted. So a copy of that was included in the consent agenda packet. It has also been posted on the website under budgets and reports. I will highlight a couple of things. One, you'll notice that you had the two ratification reports this time. We separated out the renewals for the 2026 period. And then because there are so many of those, we kept the standard approvals on that separate page so they were easier to find. But if you had any questions on either of those, let us know. And of course, the minutes. I am scrolling on the side here to get us to the director's report and want to make just a few highlights. Okay. On the budget, I do want to note that even though we're essentially at the very end of May, because we don't provide the updates until the completion of the last period before a meeting occurs, these numbers are through the end of April. So there has been almost a full month, but that's not yet reflected in the materials that you have here. But you can see that generally for this first fiscal year in the budgetary biennium, the income exceeds the budget. And that is in part that renewals came in a little bit better than we had budgeted for, which is good news. And we continue to maintain expenses as low as possible. Part of that number, though, is that, as we've noted on a couple of the prior reports, the costs related to the upgrade of the IT system, the licensing system, and the work that has been deferred pending the development of the statewide request for proposal RFP, which we initially thought was already going to be released by now, but Department of Administrative Services is still developing that. The latest update that we have is that they do expect that to be released within the next couple of months after it gets fully vetted by the Enterprise Information Systems or the state IT folks to make sure that everything that is in that will be compliant with all of the security and IT requirements for the state. The other piece on license counts, as you can see reflected here, there are some drop-offs. Those are expected. And I'll scroll to this page here where you get a better view of that drop-off in the total license counts. That is because historically, not everyone who holds a license renews it 2 years later. And in the notes here, you can see that the historical rates, I think we were tracking back to the 2018, they run between 14 and 17% of drop off, where folks who have a license do not renew that license in April. We ended up being this biennium, the drop off was only 11.5%, give or take. And that's a number that we haven't seen in several renewal periods. So that is a positive. The other reflection on that is that we do have folks that, in essence, renew their lapsed licenses really through the rest of the biennium. We've had some of that activity, but that, when we look back, that drop-off rate slowly degrades a little bit, right? So we'll probably be closer to 11% by the time we get to the end of the calendar year. The sorry about that. Part of the numbers when we look at the total capacity of available workforce. Now, this doesn't account for folks who are actually working. This is just folks that have either a license or a compact privilege, so could work in the state of Oregon. In these numbers, you can see the jump in PTA to compact privileges being about 13%, and then 10%, while the purchases of compact privileges in total have gone up for active compact privileges for this period. Part of the jump in the percentage is a factor of the total number of active Oregon licenses have fallen after the renewal period, right? So it's not, I expect that these numbers will adjust back down, but they are definitely creeping up every quarter. So we'll see how far this gap ends up as we go along. One other note is the numbers here as far as applications, particularly exam applications and total overall applications, are generally down relative to where they've been historically. The numbers that are highlighted here, which are the prior biennium, so that's the total at the end of the full 2-year period. We aren't quite to the end of the first year in this current 2-year period. But if you look at 21-23, which was about 1,300 total, and then that dropped down to about 1,000. Right now we're sitting at just under 400 with almost that first year. Now, this doesn't account for the activity for this school year. and there actually have been a lot of licenses just issued as folks have been graduating this month. So when this comes back to you at your July meeting, that'll be a really good point for us to do some updated projections and kind of check this line. But we are seeing a decline in new applications, particularly on the exam side. The other materials, you see the updates on compact privilege purchases in detail, and then highlighting the updates on investigations as far as aging and the open close rate for the biennium where we're headed. The final highlight that I wanted to do here was on your highlights where you have the yellows. Those due dates are coming up fast. I left them yellow even though I have the material. I have not submitted the forms that are required yet. That is afternoon's activity. So I have every expectation that we will hit this deadline by Monday. But because I haven't physically done it yet, I've left them at yellow so that you have that awareness that it hasn't yet been submitted formally. Otherwise, you have the detailed financial sheets and balance sheets for the organization, and of course the governor's report that was submitted. So with that, I'll stop, Madam Chair, and if there are any questions on any of the materials or if there were any corrections on the minutes from the last meeting.
Thank you, Michelle. Does anyone have any corrections or questions?
Okay, if not, then we just need a motion.
Okay. Yeah.
No questions, right?
No,
We ready
no
for a
questions.
motion?
Yeah.
I move to approve the consent agenda items as written.
I second the motion.
First and seconded, roll call vote. Timothy,
Aye.
Aaron,
Aye.
Mariah,
Aye.
Sandra,
Aye.
Hoku,
Aye.
Susan,
Aye.
Erica is excused. Dwight,
Aye.
Madam Chair, motion carries unanimously.
Okay. Thank you. I think next on the agenda is the time for public comments. If there's anyone in the room that from the public that would like to comment at this time, please identify yourself, raise your hand.
Not seeing a raised hand, Madam Chair.
Okay. Next item is the member and committee and delegate reports.
Yes, on the first one, starting with the compact delegate, Aaron is our compact. I threw onto the slide a couple of the highlights, and to note that the one in the materials, the 2025 annual report, is for the PT Compact Commission itself, and that's a link through to their full report, which is itself, I think, a couple hundred pages, right, Aaron, on that. But Aaron, did you want to do any highlights or bring in any other information on the compact side?
No, I think we're just planning for the annual meeting, which is, way down in the year in December. But outside of that, yeah, it's a big report. I looked through it yesterday. Yeah.
Yeah. And I did add in the first bullet point, one of the administrative pieces that Aaron and I get is a report on the Oregon's compliance with the requirements of participating as a member in the compact. Sherry has, and Aaron, I as well, I think, have been on the compliance committee for the compact in ensuring that piece of it. They put out quarterly reports as far as the compliance and the key metrics that they track. But I don't think that this is something that has been elevated in a public meeting before, but Oregon continues to maintain 100% compliance on the measures, and the threshold for maintaining in good standing is that 90% threshold. So I wanted to make sure that the full board had visibility into that. And if there's any questions or concerns, Erin would bring that to you when she receives those reports directly.
Yeah,
Anyone have any?
I was just going to
Go
say
ahead.
we continue to do very well, and that's thanks to you guys with the staff for the board. I do see some of the states struggle with the compliance, but Oregon is always right on. So proud to be in this state.
Uh, Anything else on this one or questions? Okay, then I'll move to Federation. And I apologize. I reversed my letters on the slide, but um, the wanted to start with any committee or task force reports. I think we have at least one, Sherry.
Yeah, I had the opportunity to participate in a model practice act, sorry, uh, Code of Ethics Task Force for the FSBBT. It was at the end of April, beginning of May. So we had about 10 people from the APTA and from the representatives from all over the country for the FSBBT looking at a model code of ethics for the FSBBT, sort of based off of the APTA code of ethics. And it was a really interesting meeting and really very productive 2 days in Alexandria, where we kind of, the Federation's looking at developing their own model code of ethics. Instead of, there's a lot of states that can't just refer to APTA code of ethics in their statutes and just say, need to follow what the APTA says. So we looked at that because the APTA code of ethics is new. So we did a really good comparison of theirs and ours, and came up with a product that the board's going to review, and they're going to talk about at the live meeting, and then go from there.
And I think one of the key drivers is the APTA has changed the way they've been framing up the code of ethics, and that many of them are framed as aspirational as opposed to something that in the regulatory world, right, is more of a concrete yes or no on that. So the really excited for the work of the task force and being able to see the recommendations for the final products. The regulatory, are there any other committees or task forces that I've missed that have met since the last meeting that anyone's participating on? Okay. The regulatory training also happened since last time, and Mariah was able to attend. I was able to attend as well. Mariah, did you want to share anything about that?
Just it was super interesting. I feel like the code of ethics actually came up a lot while we were there, and so it was, yeah, just cool to see what the other states are doing and how they're handling that and like writing their own practice acts with all of our changes kind of coming up for Oregon. And it was great just to like network and be able to connect with people, across the US and get a bit quicker at giving my elevator speech about what, the board is all about and protecting the public and knowing Oregon's stats as far as like our licensees and how many board members we have and things like that.
Thanks, Mariah.
I have one more thing. So the same weekend that Mariah was in Alexandria, I was in Bend, and I we had a item writing workshop for the NPTE, and we had 10 item writers throughout the state, representatives from pretty much each of the PT schools in the state. It's a 2-month assignment where we spend the weekend working on, sort of learning how to write items. I served as the item writing coordinator, so the item writers write the items and then I review them for sort of content and a lot of other different things. And then they have 2 months to write 20 items. So we're almost done. We have about a week left for them to write all their items. Really, really fascinating process. This is the second time I've been a coordinator, and I was an item writer. I can't remember if it's once or twice, but I highly recommend. Very difficult, not the easiest thing I've done, but really rewarding and eye-opening and challenges my clinical brain and re-energizes my clinical brain. So if anyone wants to participate, they do regional workshops. I think the last one we did here was about 5 years ago. But they do them in Alexandria a couple times a year, and you could do it virtually or in person.
20 in 2 months is a lot. For the pediatric board certification, you have to write 10 in a year.
Oh my
So,
gosh. Well, hold on 1 second. If you go in person, you actually have to write 40.
yeah, that's a lot.
So the regional is the way to go. You only have to write 20. And I would say most of the item writers wrote at least 5, if not more, during the weekend when we're there. So then you have 2 months to write the rest with the help, with the assistance of the coordinator. And then there's like somebody after me. So they write it, I review it, somebody after me reviews it. And I don't know what happens beyond that. I think there's even more levels after that person. Um, but it's a really neat process just to see what goes into writing one item for the NPTE. It's amazing.
I'm super curious about it because they talked about it at the regulatory training as well. But 20 just sounds like so many. It's
It's
very
not
interesting.
it's not that bad, but I can always talk to you about it if you're ever interested. It's I've really enjoyed it.
And it's a great way. MPTE obviously is such a vital mechanism and participation from the broader community and getting that clinical expertise and the development of items. And for the recording, just to highlight that this isn't just for board members, but this is for folks with expertise in the field to be able to participate. So if you're listening and want to get involved, reach out to us and we can connect you with the right folks for that.
Yeah. And the interesting thing too is I always thought when you did it, like they find people who have expertise in certain areas to write items on that area, but actually that's not it at all. They have certain, items that they need, like let's say cardiopulmonary, they feel like they need to write new items on that, or they need new items on pediatrics or whatever it be. So they can have someone who has had 30 years of experience in pediatrics writing orthopedic questions, or someone with orthopedic expertise writing pediatric, however it is. But they're all entry level items, and they all have to be, from textbooks and all of that. So it's not just if you have one particular expertise, it doesn't make a difference. You have to write all the items.
Thank you, Sherry.
Welcome.
On the upcoming, July is the next major event, which is the annual Leadership Issues Forum. Sandra, as the delegate, will be attending on behalf of the Oregon Board delegation. And so this is an opportunity. She will go armed with the information about what we've been up to in this conversation, your work and your direction. But in the meeting, are there any specific questions or topics that the board would like Sandra to bring to that event in order to bring information back? And what I can do is give you guys a minute or two, talk a little bit about the rest of the things, and then I'll loop back to that. Otherwise, again, Sandra will just go with sort of our list of topics that have been discussion for the board and in your strategic direction. The Federation will also go through and give updates on all of the committee work that's been happening and any new development for delegates to then bring back after that meeting. The next upcoming after that will be the annual education meeting in South Carolina, Greenville, this year for October. So that'll be our delegate and alternate delegate participating in that. I did want to note that one of the items that happen adjacent to the annual education meeting is the election of board of directors and nominating committee. And to let you know that I have been slated to for a position on the board of directors. I am at the end of my first term in that role and have been slated again on the as a candidate for that position for the next term. And I did also want to do staff recognitions. Sherry Peru was highlighted in the news brief that goes out from the Federation to all the stakeholders in recognition of her quite extensive paragraph of just work and dedication for many decades, if I can say that, Sherry, in multiple roles. So I do recommend that you get a chance to look at that news brief and scroll to the end where she is being highlighted for her contributions to the Federation. I did also want to do a quick shout out to Sarah Casey, who in this month is celebrating her 10th year with the state of Oregon. We haven't had the benefit of her that entire time here at the Physical Therapy Board. Nonetheless, she has been in public service and serving Oregonians for 10 years now and going. So thank you, Sarah. And I'll just loop back to Leadership Issues Forum if there was anything else that in particular, beyond kind of your hot topics that you wanted to make sure that Sandra addressed or asked while she was in those communities. Beaucoup.
Can I just get a little refresher on what those things are on our list so far?
Absolutely. The
Thank you.
In fact, one of the things that might make sense, since we're going to talk about sort of our topics and the strategic planning focus, I could go forward to those items and then loop back and ask this question again after that, if that would be helpful.
Yes, please.
Okay. Any other highlights on Federation or questions before I move on to do that?
Oh, just one more thing from the regulatory training. I had so many people come up to me and just say how amazing Michelle is and how helpful Michelle is and just like singing your praises. So that was also very nice to just hear the entire weekend.
Thank you. Okay. Strategic planning progress review. The focus for 2026, just as a reminder, and I'll give some updates on this. Obviously, in an even numbered year, renewals absorbs the tail end of the quarter of the prior year and all of the first quarter. So that has been the lion's share of the focus. We gave you some of the numbers as far as lapsed and the um, the totals came in higher than we were anticipating at the March meeting, which noted previously was very good news. The couple of related activities, even though the renewal period is complete, the audits that we perform, both on the continuing competency certificates and compliance there, as well as the running the background LEDs or Oregon Law Enforcement Database background verification related to renewals. We had originally projected that we would also be able to complete that um, uh, in part during March and April, and that we didn't have the capacity to be able to do that. So they've been started, but they're not completed yet. So I anticipate that updates on those audits will be brought to you for your July meeting. And the background audit does take a little bit longer. So that was originally projected April through August. We're currently still targeting in that time frame, but it'll be toward the end of that time frame. Any other questions on renewals?
Michelle,
Yes,
Michelle,
ma'am.
are you still auditing 100%?
We are auditing effectively the 100% on the background verification. On the continuing competence compliance, we are doing a percentage, a randomly generated percentage with there are certain categories that fall into a review if they meet certain criteria. When we scan through and we have identified that there is unreadability or uh, issues like where we can see that they're clearly the name of the course doesn't match what's required, particularly on pain management is the most common for that. So those, if we see any of those get a full audit, and then we also do a percentage above and beyond that. And Sarah, I believe the 20% was for the fully
Yeah,
random.
so between stuff that gets flagged, like say that's around 12% or something, then we're doing a random for to match up to 20%. Yeah.
Thanks.
Absolutely. The other very significant body of work for the focus is rulemaking and related program development and procedural changes, and probably IT system changes that relate to the House Bill 3824. That work continues through mid 2027, and the reason for that is that the go live date on the rule or the statutes, what they call the effective date, is July 1, 2027. So even though all the work will happen before that, none of it effectively goes into effect legally until July 1, 2027. The body of work, working to develop the rules, working with external work groups and stakeholders, will effectively happen within this calendar year. And part of that is because it takes time to implement the rule, to promulgate the rules and go through that process. And then if there are any things that need to occur to develop forms or modify the application or anything on the system side, we need the time to be able to implement those as well, not just the rules. So this is where we're shifting into that. We've brought, in past meetings, we've brought sort of the projection of, I think of all of your administrative rules, there's maybe two that don't require at least some update or change to it, as well as with the new scope in different areas, entirely new rules and programs that will need to be developed. The looping back to your financials, one of the pieces that even though it wasn't part of the specific budget projections, with the other work that we have on our plates, I would recommend to the board that we explore bringing on temporary staffing specific to implementing this body of work. There is, even though it wasn't specifically in the budget, as you saw currently, there is budget capacity within the approved budget. If the board is comfortable with me exploring bringing on some additional staff support for specifically limited temporary support for this body of work, that would be a recommendation that I would make. I believe that we would be able to manage things through the rest of the biennium, but it may mean if expenses in the second year of the biennium are higher than expected, that we at that point would need to consider a budget increase. Not a fee increase, but a budget increase relative, which means we would use more of the current reserves for this biennium. So I wanted to check in before proceeding. I will also note that I am going to explore options for grant funding or other ways to fund it. But I wanted to check in with board to see if you're comfortable with us pursuing that approach.
Tim?
I am very in support of the executive team looking into finding additional labor to help with the rulemaking implementation.
Hoku?
I feel the same way, and I do wonder, like, where would we find said staff people? Like, what, in what capacity? How do you locate people who are qualified to help with the rulemaking process?
Great question. I did do some querying of other agencies to determine what resources they use. And there are individuals that essentially they have experience in project management, facilitation, working with work groups, rural development. So there are individuals that have those skill sets that work with other agencies or other organizations. So it would be that kind of skill set. I think I probably should have explained that part of the reason I'm making this recommendation is looking at everything else on this page, as well as continuing day-to-day operations in order to do this well. And something that I think is one of the most critical things to do well, right? Implement the new laws. We would have to either not do something else, or there would be an operational impact to use existing staff to put the resources that we need on that. And looking at this list and what we do, I'd prefer not to have to do that unless we had to.
So do we need a motion for that?
I don't think you need a motion because it's within the existing budget that you've already approved. But just if anybody has any concerns, or it can just be a staff direction.
I think, yeah, it sounds, sorry, it is a lot to take on, and I think that we do want to get it right, and we have a lot of expertise on our staff. But I was looking at that one part of that report about 500 phone calls a week or something like that answered. I think could definitely support extra help in this area.
Thank you. The next item, the licensing system stability and replacement. This is in part one of the drivers why it's also a mission critical piece. We've highlighted before that the current organization that the licensing software we have, the company that owns that, is in a proceeding, and the long-term viability of that licensing system is unknown at this time. We are also, Sarah, I think there's only 2 years left on our current contract, roughly.
I think 3. I think it runs till 2029.
Okay. So that's sort of the hard boundary for us to need to start the process to either entering into a new contract with the current vendor where there are some concerns or go out to another process. We've previously talked about the fact that the state is exploring a statewide request for proposal. We've been talking about that for a while because we expected that to have happened last calendar year. And I think, as I noted earlier this morning, we're probably still another couple of months before they release the RFP, or at least before there is a viable option. So the other thing that happened is where we thought that that we had a little more time with the current vendor, and then we thought that there would be the release for the solicitation. The timing worked out where both of those things are now going to be within the same period of time for us to make plans on what that is. But there is movement, and so we are hopeful that the request for proposal will be out and available, and that there will be bids and the opportunity to look at what other system options there are for the board to consider. I doubt that there will be information for your July meeting, but perhaps at least some preliminary information. But definitely by the next meeting, we should have some information for you to discuss on different options that are available to you. Sarah, did you want to highlight anything else on that?
Nope, I think you covered it all.
Okay. The next item has sort of an arrow trying to convey that there is sort of an extension on this one. The federal implementation deadline was originally April of this year. I think a week before the deadline or so, they extended that deadline out to 2027. So given that a lot of that work was happening during renewals, we did shift and complete. And Sarah, I apologize, I've misplaced my notes on that one. Can you highlight of the required review on the website, the percentage that we're estimating has already happened?
Yeah, so I think that just from the actual straight up compliance component, we are fully compliant on the website right now. The few exceptions would be things like historical PDFs, but we do have some kind of captions on the website saying if you use a screen reader and you can't read this, contact us and we can get you an accessible version. So we should be roughly 100%. There is more work to do, but that's more to make it look nice rather than look compliant. So yeah, we're in good shape on that. I don't foresee that being a huge lift when the new deadline comes around.
Then in education and outreach, we had brought to you some preliminary information with regard to the shift to the use of emailing product to give us better control and visibility into read rates, open rates. We'll give you more information and details in July. But I did want to highlight that we look pretty good when you look at delivery rates. We're at 99.8%, and that means that it gets through to the individual, which is a very good, it means we have, and it's not surprising, it means that we have a quality list, right? So that people are giving us addresses that work and that we can get the information out to them generally. We're running at about a 40% open rate, which is slightly above the government sector, which is 39%. So again, we're doing pretty well as far as email outreach. The most recent news brief that went out, we do design the news briefs to the greatest extent possible to try to um, condense the information into usable information that you can just look at the email itself and not have to open a PDF or link through if you don't want to, but then also provide those links for more information. So for the most part, if they're opening it, we can't say for sure that they've read the full email. We just know that they've opened it, but it is designed that that's the only step that they have to do for most of the key information. When we look at folks that then follow any of the additional links that we include, those are lower. There's about 6% of the folks are clicking to some of the links or the resources that are provided. One of the other pieces that I wanted to highlight on this most recent newsletter is that you had asked us to begin sending out additional helpful resources in those news briefs. And one of the items that we did highlight this time was the Federation Sexual Misconduct PDF brochure that's available for practitioners. And of the people who clicked into any link, 44% of those clicks were to that resource. So I think that your instinct about sending out that information, and I think it demonstrates that it was seen as valuable based on those click rates. We'll bring more in July, but I wanted to just give you at least a verbal update on that piece of the education and outreach. The second piece is at the last meeting and as part of your overall strategic planning, you've talked about wanting to get elsewhere into the state to increase access to the board and to different programming. And in the last meeting, we brought to you the idea of aligning those kinds of opportunities for interaction in face-to-face in-person interaction, and then a board provided continuing education opportunities for licensees out in Oregon. Sherry has spoken with folks in the Bend area and is targeting end of July to see if we can coordinate that. And Sherry will talk about where that would be hosted and where how that's currently framing up.
Yeah, thanks, Michelle. So as part of my job, I go out to all of the PT and PTA programs, usually in the first year and then end of the second or beginning of the third year. So I usually go in the summer to OSU Cascades in Bend to speak to their classes. So they reached out to me this week to do that at the end of July. And so I'm in conversations with them to talk about doing a continuing ed educational session in conjunction with me being out there. So not for the students, but for licensees, probably the 27th or 28th of July. Kind of trying to figure out the topic now that, just refreshed my memory when Michelle said how many people clicked on the sexual boundaries resource in our last news brief. So I'm thinking maybe that topic or a little bit of an update on, what's going on with the bill and statute and rule changes. So I'm going to work with the folks at OSU Cascades to give a space to hold it. And once I have that in place, then we can sort of figure out exactly what the topic's going to be and how we can advertise it out around that area. And with their help, they're really excited to participate.
So that'll be our first trial. it will be sort of adjacent. It may not quite have occurred by the time of your next meeting, but it'll be scheduled, and we should have a sense of attendance, even if if it hasn't actually happened yet.
Yeah, and if it is that day, the 27th, I think the board meeting is just a couple days after.
Yeah, if it's 27th. Yeah.
Yeah.
So more to come to there, and then we've already started looking ahead at sort of using this mechanism of school visits to sort of co-align these kinds of offerings. And we can use this initial one and get feedback from folks who are attending to inform, what works well. But I think one of the next ones would be Southern region, Sherry.
Uh, yes, there's also Western Oregon, which is out in Lebanon. So that might reach out to people in like the Salem area. And then there's a PT program in Klamath Falls, a small PT program. And then down
All
in
PTA programs,
yeah,
Southern in Medford.
right. That's what I was gonna say. In Medford, there's a PTA program. So I might chat with you soon, Susan, to do that.
So so making progress, and we'll have more detailed updates in July, but I wanted to be sure to highlight that is moving forward.
Michelle,
Yes, ma'am.
I can't figure out how to raise my hand on this. When you were going through the emails, you talked about I just was a little confused about the data you were giving us. So you said 99.8% of you meant we had a clean list. Tell me what that was how that was measured again, because then you went to a 40% open rate. Is that correct? Would you
Sure.
I'm sorry, I just wanted to see about how the email thing was working. If you could go through that again. Perfect.
Absolutely. And we'll in July we'll make sure that there's a slide to show you this. But the first sort of funnel for the email marketing as it's framed out is the delivery rate. And that's just whether the email got through the person's inbox.
So it didn't just get bounced back. Okay.
Yeah.
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 Okay, thanks.
Sure. And do you have the others, or do you want me to?
No, I got the
Just that
rest,
one?
but I
Okay.
was thinking it meant something different. So then when it went to only 40% opened it, I was like, ow.
Yeah.
So,
Yeah.
yeah. Thanks.
Absolutely. Other questions on that part? Okay.
I want to add just another kudo for you, Sherry. I think it was the Federation email that I was reading that had a link to the video that you did, and then that little course thing that I watched the other day, and I just, oh, it's so good. So thank you. The information's so good. It's well presented and
Thank you.
clear. Yeah, it's really good.
Yeah, they for anybody else who hasn't yet seen the news brief or scrolled all the way down to see the highlight on Sherry, they did include links through to two of the webinars that she's given as part of the Federation.
Yeah, they're good.
Yes. So on the last bullet, the strategic plan engagement and update, you did a body of work at the March meeting looking at SWOT information that's being incorporated into the document that'll come back to you for the next term. And you had also directed, as far as community engagement, you had approved proposed questions to go out to a community survey. We have those framed up. We have not sent that out for two reasons. One, we had inundated folks with renewal information for folks that were still renewing, and then we had just sent out the other news brief. And Sarah had astutely raised some concerns of email overload and not wanting to overwhelm folks. And so we decided to wait before reaching out on the questions that you had approved. And the other piece that we're going to attempt to do is that in the interest of trying to make the ability to participate as easy and seamless as possible for the broadest number of people. The one downside to the open-ended questions that you approved is that somebody does have to take the time to actually, type out input. And with busy as some folks are, we're looking for a way to provide some sort of other scale answers so that at least some folks can respond and give us some input, even if they don't have the time to take out to write out full narrative feedback for us. You'll still have the questions that you approved, but we're looking at the best way to kind of incorporate both in order to maximize the ability for folks to participate. So we do anticipate that that will go out and we will have the results of that information to bring to you for the July meeting, but that has not yet happened for those reasons. Any other questions?
Not seeing any hand.
Okay. The next item is just as we do for you each meeting, this is the list of the current future topics and reports. We don't have any new information to bring to you for this meeting. This is still the working list. But if there are any other questions on this, this also loops us back to the Leadership Issues Forum, both the prior item on the focus of your strategic initiatives and then these topics here. If there's anything else that beyond this that you want Sandra to ask questions about or focus on bringing back information to you from the life meeting. Okay, it looks like we're good with both the prior slide and related activities and then these topics. Okay. Next item we wanted to give an update on the HRRI Healthy Practice Resource Pilot that you initiated. I threw this in here just as a reminder for folks on the scope of the pilot for the use within the complaint and investigative processes. This was the material that was covered in the last meeting. And in that process, we did reach out to the individuals that had completed one or more modules during the continuing competence period. And we had, it's a relatively small population, right? Roughly 20. And we did have some folks that did respond and give us some preliminary direction that nobody raised any issues with it moving forward. And we did get some feedback on just their experience in taking the modules in general and whether or not that was helpful. And most of the people that responded felt that it was, I think, out of 5 stars, like a 4-star on that. A couple of folks, well, I think one individual that responded felt that some of the reading materials that were associated were a little uneven. Some they felt were really helpful. Some of the others they felt weren't individually helpful on that. But that didn't have to do with the pilot. That was with the modules themselves. So where we are right now is in working with any other interested parties that are completing the module and want to give any other input. And the reason that's sort of an ongoing cycle is that also as we move into the implementation of the pilot itself, that as folks participate, they're also being invited to give feedback on the tools and the pilot and how effective it is how effective they find it for their situations. So that's where we are in the process. We're moving into rollout. I anticipate that this will roll out in June formally. Sherry and I have been working on the specific like template that folks will fill out and use as part of the process. So what that means, since you set a formal review point 1 year from implementation, I moved it forward a little bit, but at your July meeting in 2027 will be effectively that first year of the pilot. Any questions on this one? Okay. Then on this, we did not have any other items to bring to you unless anyone had any else from old business, other business from the agenda. And not seeing, then Madam Chair, I will turn it back over to you.
Okay, so if there is nothing else, then the time we have our upcoming meeting, so upcoming meetings in July, virtual, and then the time is 9:37, and the Oregon Board of Physical Therapy is adjourned.